Unite's preliminary delivery manual for the rest and restore protocol. Preparing for delivery. There are 3 models of program delivery. In person refers to you and your client being together in a live shared setting. This often means a traditional clinic or office environment, though it may include a client's home or meeting outdoors. Remote describes virtual care environments where you and your client are in different locations and connected by a video technology platform such as Zoom. Everything else about your delivery remains the same, except you are not sharing the same physical space with your client. Independent listening refers to the client listening without the presence of a provider, usually at home, although the provider closely monitors the client through phone, email, or other communication platforms. RRP is designed both technically and clinically to be delivered with any model. You may wish to combine delivery models to include in-person and remote delivery through a hybrid approach. Choose a delivery model that feels right for your client's nervous system, balanced with practical and logistical considerations. Remember that when your clients listen independently, your role as a provider remains essential to successful and safe delivery, and ensure that the client is ready to listen on their own before progressing with this model, and continue to support your client by checking in between sessions and monitoring their listening on the MyUnite dashboard. Program management. Access to each level in RRP can be manually controlled by the provider. When adding a client and managing the RRP programs for remote delivery, consider enabling access only to the level your client is ready to listen to. As you and your client progress through the delivery experience, you may remove or open access to additional levels as indicated. Listening environment and readiness. When identifying an environment for listening, consider how it contributes to your client's neuroception of safety. For most clients, a quiet, relaxed environment that allows them to passively receive the program is best. For others, being in nature or viewing a natural area can be supportive. Environments that are noisy, stressful, or highly stimulating are not generally recommended. Some clients may prefer to listen in the same place where they sleep. This can be supportive if that environment feels safe and comfortable to the client. Many clients report that listening to the RRP before sleep helps them more easily fall or stay asleep or access deeper sleep. For some clients, report that listening to the RRP before sleep helps them to more easily fall asleep or access deeper sleep. For some clients, listening immediately before falling asleep can increase the intensity of dreams and even be disruptive. For those clients, it may be best to allow some time before falling asleep to integrate the experience. Some clients may report feeling fatigued or have difficulty concentrating immediately after participating in RRP. In those cases, it may be best to avoid listening during the workday or prior to engaging in socially or cognitively demanding activities. Many clients report a preference for closing their eyes during the listening to help them turn their attention inward. This is a welcome practice that may contribute to desired outcomes of RRP. Conversely, keeping the eyes open can allow for co-regulation and connection with the provider, peer, or environmental cues of safety. Sensory supports such as eye coverings, lightly weighted pillows and blankets, and aromas may be appreciated. Be mindful of clothing selection, textures, and colors of materials, and how these influence nervous system state. Take time to explore and experiment with what feels best for your client. Activity and positioning. Give your client options for what body position feels best in their system for listening. One goal of RRP is to reduce skeletal muscle activity, allowing the body to feel safe at rest. Being in an upright position can provide a challenge to the system and may interfere with this intention. Generally, clients are recommended to be still during the listening period to limit the influence of movement on heart rate, blood pressure, breathing, and other physiological processes. Stillness can be achieved lying down, sitting, or in a reclining position. A reduction in skeletal muscle activity can feel vulnerable, and for some, be sensitive to your client's comfort with this experience. Observe that this vulnerability in your client during listening helps them feel safe with stillness. Gentle movements such as swaying and stretching, light activities such as puzzles, drawing, coloring, or other expressive arts, journaling, or restorative yoga postures may be supportive. For some clients, movement can decrease the intensity of the experience and may make sensations more tolerable. Significant life events or other stressors. Consider what else is happening in your client's life during the time of delivery. Difficult life events such as illness, injury, surgery, job, or school changes, medication adjustments, or other stressors can be taxing for the nervous system. Starting RRP during or immediately after significant life events may require special attention, titration, and support. RRP can be helpful and protective for some during these periods, while others may benefit from slowing down or taking a pause to settle. Try to find a time in your client's life that allows them the flexibility and space to fully participate in the RRP experience. With unexpected events, work with your client to modify their listening plan according to their nervous system's response. Special considerations and safety recommendations. The following recommendations for special cases and high-risk clients are intended to support and guide RRP delivery. They are informed by our clinical testing process and would benefit from more data and insights. Based on our best understanding today, RRP is low risk for most clients and can improve access to the healing qualities of dorsal vagus parasympathetic nervous system. The following recommendations are made out of an abundance of caution, knowing that we still have much to learn about the effects of RRP, and we will continue to adapt these recommendations according to the best available data and insights. Low blood pressure. Clients with low blood pressure would benefit from listening in a reclining chair. This is because the potential reduction in breathing and heart rate may further reduce blood pressure, and this may feel uncomfortable for some, and in extreme cases could lead to syncopating. Depression. Clients with a history of depression or predominantly dorsal vagal presentation may benefit from additional regulatory support and titration to have the best experience. Be aware that some clients may report feeling low or blue after listening. This can be an opportunity to develop new associations with the dorsal state to allow for rest and recovery. Providers should consider infusing the client's system with protective ventral activation through co-regulation and activities that engage the social engagement system or play. Anxiety. For some clients, feeling the physiological effects of the nervous system down-regulating can feel unfamiliar or even uncomfortable. Example, heart rate and breathing slowing down. They may report anxiety around these physical sensations, titrate RRP according to their tolerance, and support your client in exploring and developing new associations with these sensations. Ear discomfort, earworms, or ringing in the ears. During clinical testing, a few listeners reported ear sensations, earworms, a piece of music occupying the mind, or ringing in the ears. In most cases, these sensations were resolved on their own. Out of caution, delivering RRP to clients actively experiencing tinnitus is not recommended. Proceed with caution in delivering RRP to clients with mild presentation or a history of tinnitus. Only providers experienced with working with clients with tinnitus should consider RRP delivery for these clients, and consultation with the client's medical doctor or audiologist prior to delivering RRP is recommended. Gut changes. Loose stool, diarrhea, and abdominal sensations such as gurgling. During clinical testing, an interesting pattern emerged of gut changes and sensations during and after listening. For some, this was a positive sign of RRP's impact, and for others, a welcome relief from constipation or digestive challenges. In a few cases involving clients with more significant or diagnosed gastrointestinal GI dysfunction, these sensations were more extreme, unexpected, and more difficult to manage through the resolution. Be sure clients with pre-existing GI challenges are aware of the potential side effects in your informed consent process.